All right, let's dive in. Today, we're taking a look at a really innovative approach to one of the toughest challenges in healthcare: how to support someone through those first critical steps of addiction recovery. We're going to break down a system called First 30, and it's all about providing structure right when it's needed the most. So, let's start by zeroing in on what is, without a doubt, the single most decisive period in this entire journey. This first month, it isn't just a block of time on a calendar. It's everything. It's that moment when the foundation for a whole new life is either set in stone or it starts to crack. And this image right here just captures both sides of that coin perfectly. On one hand, you've got all this chaos, this uncertainty, and just immense vulnerability. But on the other, there's this tiny little sprout of hope. This first month is the critical window where having structure and support isn't just helpful, it is absolutely essential for any lasting change to take root. Yeah, this question really gets right to the heart of it, doesn't it? Because this isn't a one-sided struggle. The challenges are obviously profound for the individual going through it. Of course they are. But they are just as real for the clinical teams on the front lines. So let's kind of unpack both sides of that equation.
Okay, so let's look at how this challenge actually plays out from two very different but deeply connected points of view. Understanding both is really the key to seeing why a new way of doing things is so desperately needed.
So for the client, the risk of dropping out of treatment is at its absolute peak right at the beginning. Engagement can be really spotty between appointments, and that's when people are most alone with their own thoughts. Now, for the providers, the staff are stretched thin, often totally overworked, and the sheer amount of paperwork can pull precious time away from actually being with patients. So you've got the client's vulnerability crashing right into the provider's operational strain.
And that right there brings us to the most crucial point. The real danger zone isn't always during the therapy session or the group meeting. No, it's in all those hours and days between those scheduled appointments. That unstructured, unsupported time, that's where things can fall apart. That's where the risk is highest.
Okay, so now let's look at a solution that was designed specifically to bridge that exact gap. It's a program that aims to fill all that unstructured time with purpose, with guidance, and with real support.
So what is First 30 exactly? Well, at its core, it's a 30-day curriculum, all based on proven clinical methods. But listen, the key word here is enhancing. It is not designed to replace counselors or get rid of existing treatment. It's meant to be this powerful, supportive layer that just reinforces the amazing work they're already doing.
Now, what's really important here are the clinical values that are basically baked into this system's DNA. For any kind of support to work, it has to feel safe, right? So by being trauma-informed, it recognizes that many people struggling with addiction also have past trauma, and the approach is careful not to re-trigger them. And by being gender-responsive and culturally relevant, it just makes sure the program speaks to people as individuals, building that trust and sense of dignity from day one.
And this isn't just about feeling good, it's built on a really solid foundation of clinical excellence. It lines up with established industry standards like the ASAM criteria, which is basically the official rule book for figuring out the right level of care. It's also built from the ground up to be ready for all the insurance and documentation stuff that providers have to deal with.
So how does this all actually work in the real world? What does it look like for the person on their recovery journey, and how in the world does it fit into a provider's already busy workflow?
This slide just illustrates the two-part engine that drives the whole system perfectly. Over on the left, you see that daily structure. Day 1, for example, is all about setting a baseline. There's a welcome video, a self-assessment. It's predictable, it's grounding. But then on the right, you see the solution for the unpredictable moments, 24/7 on-demand AI support. This is for those sudden, unexpected crises, like a massive craving hitting you at 2 in the morning.
So for the person in recovery, this all translates into this incredibly practical daily toolkit. We're talking short 15-minute lessons that are super easy to digest, not overwhelming at all. There are interactive trainings to build new skills, a simple way to track your own progress, and of course that crucial AI chatbot, ready with grounding exercises or coping skills anytime, day or night.
Okay, now let's flip over to the provider side of things, because this right here is a really important piece of information. The system is explicitly designed to not create any compliance headaches. This exact wording is used to reassure providers that using First 30 won't mess with their existing billing or legal frameworks.
So let's just translate that into simple, clear benefits for a treatment center. It means no new compliance risk. It means no disruption to their billing. The activities inside First 30 are designed to support services they are already billing for, like counseling, so it enhances care without adding a bunch of red tape.
So here's the bottom line.
What actually happens when you put this kind of structure and support in place? What are the real, tangible results for both the clients and the programs themselves?
Well, the data shows a pretty clear ripple effect. Programs that use this kind of structured pathway see better attendance, especially in those first 3 critical weeks. They see better continuity between sessions because clients are just more engaged day to day. And the documentation gets more consistent, which helps the entire clinical team stay on the same page.
And this brings us to the operational and, well, the financial impact. And it's pretty straightforward. Better engagement means more kept appointments. That leads to more billable units and, quite simply, fewer empty chairs in group sessions. Better clinical care directly supports the program's financial health. It's a win-win. So when you really boil it all down, the success of this method isn't some kind of magic. It's a powerful combination of what we already know works: proven therapies, consistent daily engagement that builds new habits, and a personalized plan that helps clinical teams tailor their care better than ever before.
You know, in the end, all of this structure, all of this technology, it all serves a very, very human purpose. It's about getting someone safely through the storm to the other side, to a place where they can truly believe in the simple but incredibly powerful idea that there is hope and there's a future worth fighting for.
You know, maybe the best way to think about it is with this analogy. First 30 is like the scaffolding you see around a building during its most critical phase of construction. It's not the building itself, of course, but it provides that essential temporary support that's needed to make sure everything is built on a solid, stable foundation.
And that kind of leaves us with a final thought to chew on. This model of providing intensive, structured support during a really critical transition, it's powerful. It really makes you wonder, doesn't it? What if every critical journey in life, whether it's in health, education, or just personal change, had its own first 30? What could we build then?